Hello, and welcome to Profiles and Issues, the new cable TV talk show that offers in-depth interviews with prominent leaders in the news. I'm your host, Dennis Rudin. Join us each month on Cablevision, Channel 75, Verizon Fios, Channel 34, or on your computer or iPhone on YouTube.com and www.greenbergny.com. Go to the left-hand green side of the website page and press Public Access TV on demand to view the broadcast right away. We want to make the program interactive with you, the audience, so please email us at profile.issue@yahoo.com. Let us know your opinion about the program and the issues presented. Many citizens are in a state of anxiety over the cost of affordable health care in this country. President Trump's federal proposed budget plan, according to the Office of Management and Budget Director Nick Mulvaney, calls for cuts of between $800 billion and $1.4 trillion in future spending on Medicaid for low-income Americans and children. Can we save affordable health care for individuals in New York State? Is the proposed New York State single-payer health care plan the answer? With me today to discuss this question is Health Care Chair of the New York State League of Women Voters, Madeline Zevon. Madeline, welcome to the program.
It's good to be here.
Could you explain to the audience, what do they mean by single payer?
It means one payer. There would be one policy for everyone in New York State. Everyone would have the same policy. There would be no private insurance companies. Medicaid and Medicare would be rolled into it. There would be one payer.
So if Medicare and Medicaid are rolled into it, then in other words, everybody is paying for everyone else.
Everybody will have the same policy. It would, well, I can go into the detail of how it's paid for, but that's basically what single payer means. One payer.
Okay, so if it's one payer and you don't have individual premiums, then it's just like Medicare is, right? Where the government sends a check to everybody.
Yes, it would be paid for by a progressive tax, just the way we pay for Medicare now, and it would cover 100% of the population, birth to death. Everyone would have the same policy. Doctors and hospitals, it's a private public way of it's not socialized medicine, where socialized medicine is when the government, the doctors work for the government and they own the hospitals. Here, the hospitals and the doctors would remain as they are now. And the difference is, instead of an insurance company reimbursing the hospital or the doctor, it would be the New York State Trust Fund.
But where I need clarification, I assume the state government is going to send out the checks to everybody.
To the doctors and hospitals, right?
Oh, but
they would, the doctors and hospitals would submit their charges, and they would, instead of being reimbursed by the insurance company, it would be just the way Medicare works.
Okay.
This would be Medicare for all.
Okay. Now, there are no deductibles?
Right. There will be no co-pays, no deductibles, no premiums. and no restricted networks. People can go to any doctor or any hospital they want. In New York.
That sounds unbelievable.
Well, we're not inventing the world.
How are we going to do this without federal help?
Well, part of the bill is to get a federal waiver from the government so that Medicare and Medicaid funds would be rolled into one entity and would go into the New York State Health Trust Fund. And that's where the trust fund will reimburse the doctors in the hospitals.
Who do they have to get it from? The Congress?
It has to pass in the state legislature. It has to pass in the Assembly and the Senate and be signed by the governor. And that would make it a law.
Okay, but they don't need any permission from the federal government to do this, right?
No, states have the right to set up their own.
To do this.
Yes.
Has any state been successful in doing this at the time of our
Many
taping?
states are in the process of getting this. Today, a bill similar to the New York health bill in New York State passed in the California State Senate. And so I think New York State and California are the two states that are very close to this. But many other states around the country are working on it. Vermont, Colorado, Massachusetts, many states are working on getting a single-payer bill in the state.
Now, does everyone have to participate for the plan to work or not?
Well, everyone would be in the plan because there would be no other other options. I mean, most people are pay for Medicaid and have Medicaid, and they're happy to do that.
Right.
And I think people will be happy to do this too because it has better coverage, it's more comprehensive, and it's cheaper. So I think most people would be delighted. Most people do favor it. There was a Gallup poll last year, and they found that 58% of people prefer single payer, would like to have single payer, and that includes 41% of Republicans. So,
really?
Yes, that was a Gallup poll that was done last year.
Boy, am I learning things. I never thought I would hear that. All right.
Well, not many Republican legislators vote for it, but their constituents want it. But instead of voting the way their constituents want, they vote the way their donors want.
Right, okay.
And that's mainly the insurance companies and the drug companies, because they're the ones that are strongly opposed to the single payer.
So then everyone would be automatically put in the plan.
Yes.
It's not optional,
No.
and there's no penalties that individuals would face.
No, no penalties.
Like some of the things they're talking about on the federal level. Yeah, all these
well, that's
problems
the Affordable Care
Yeah,
Act
right,
has
right,
that.
right.
Yeah. No,
okay,
this is different.
Let's talk about. Well, you say it's going to save us. It's going to save New York State a lot of money. Could you give us examples and what medical services like would be covered in this plan?
Every medical service, every medically necessary service would be covered. In fact, it would be more comprehensive than even private insurance companies. So
you mean such things like as preventive care?
Preventive care.
How about specialists in the hospital?
Specialists. It would cover, in addition to the normal things that are covered, it will cover dental, hearing, vision, substance abuse, mental health. It's very comprehensive.
Is this partly because in his State of the State, Governor Cuomo mentioned about trying to get the drug companies to cooperate and to lower their prices? Was he able to do this, to get this kind of proposal, or, you know?
Well, part of the bill is to negotiate with the drug companies to lower prices. Drugs that are manufactured in this country cost twice as much as they do in Canada or other countries. So part of the bill is to negotiate with the drug companies. The Veterans Administration negotiates and gets lower prices from the drug companies in this country. So with this bill, it would be similar to what now happens with the VA medical treatment.
I also notice from conversations I've had with individuals that, like you said, the prices may be double here on regular drugs, but people that have certain need for pre-existing conditions, diabetes, special, special problems like that, their drugs, according to to these people, are off the wall. Their prices, even if they're covered on insurance plans, 3 times, 4 times as much.
Everything would be covered.
That's fantastic. Now, you said that would cover 100% of all the people in the population.
Everyone. Even undocumented immigrants.
Really?
Yes. Anyone residing in New York would be covered.
Now, is this bill gonna help lower taxes, or maybe even raise taxes in Westchester County?
It would lower taxes.
How would it do that?
Do you want me to go into the economic study?
Well, let me
just say in general, the economic study
Go ahead.
showed that New York, the bill would save $45 billion a year in New York State, or $2,200 per person. So what I'm saying is that even though it's more comprehensive and 100% of New Yorkers would be covered, it would still save $45 billion a year in New York State. And if you want me to go into the details, I could.
Well, just, some.
Okay, this is an economic study that was done by Gerald Friedman of the University of Massachusetts in Amherst. And he found that $26 billion would be saved a year by eliminating insurance administration and profit. Believe it or not, private insurance currently spends 20 to 30% of each dollar in overhead, profit, marketing, whereas Medicare spends about 2 to 3%. So 26 billion would be saved.
And the insurance companies are just accepting this?
No, they're not. No. The insurance companies have a lot of money, and they're They have a lot of lobbyists, and they're certainly very much against this. 21 billion would be saved by reducing medical practice insurance administration. Doctors and hospitals have to hire many workers to process claims and fight for reimbursement. 2 billion would be saved by eliminating employer administration. Employers have to negotiate with insurance companies to cover their employees, so this would not be necessary. So it would save money for employers. 5.4 billion would be saved by reducing fraud. Sometimes there's accidental duplicate billing because insurance companies are the forms very complicated, and each one has a different procedure. But if fraud is deliberate, public authorities would have greater subpoena power. And very important, $16 billion would be saved in overpriced drugs and medical equipment. So the New York Health Plan would be able to negotiate with drug companies to lower costs. So the total of savings would be about $71 billion, but because everybody would be covered, so you'd have to meet the increased coverage, that would cost $26 billion to cover those who are not currently insured. So if you subtract the cost of $26 billion from the savings of $71 billion, the net savings would be $45 billion. And that's $2,200 a person. And over 98% of New York households would spend less on health care.
So
That's it.
if I just want to
That's the
clarify this
economics
point
thing.
that you made.
Okay.
That was great.
Okay.
It sounds like sounds fantastic. Sounds like Wonderland. And I'm not saying that in a disrespectful or mocking way, but we hear so much negative news on healthcare
Yeah.
from the federal government that this is like, I feel like I'm on vacation, you know?
Well, this has been a political football, but we're not inventing the wheel here. Other countries do it. I was talking to this businessman who has a medical equipment company in Ithaca, New York, and he has a subsidiary in Canada, and he pays twice as much to cover his employees in Ithaca than he does in Canada. So you would think he would just take his business to Canada. But this is a man who started his business in Ithaca and has the same employees for over 30 years, and he doesn't want to move to Canada because they're very integral to his company. And so he's just paying twice as much, but most companies would leave. And if this was enacted, I think this would attract businesses to New York State, particularly upstate area, which is depressed in many areas of upstate New York. I think if New York was the first company to enact this bill, I think this would attract companies and bring a lot of jobs to New York State in that area.
I would assume also that the small ma and pa business or with employees under 10, this would be a terrific boom, right?
Because all of their employees would be covered. Everybody.
How about the individual owners of those companies? Could they, small business, could they go on it themselves?
Of course, if you're a resident of New York, and if you, say, spend the winter in Florida, you can still build the New York Health Trust. If your primary residence is in New York, you are covered, even if you get treatment out of state.
So then this would also increase their profits because it would bring down their overhead costs.
Absolutely.
And this is one of the big problems that voters were complaining about in the presidential election. And that's why they turned to President Trump, because he had a plan, so he said anyway.
Well, the plan is...
Right. Well, with regard to health care, that's what we're focused on. We'll talk, so, I'm not trying to play devil's advocate with with the audience. I'm just trying to let them know what's out there. In fact,
with Trump, I think people are, as you said at the beginning, they're very worried. And I think the fact that we do, there is a federal bill for single payer, and it's...
is that in the Senate now?
Well, it hasn't been brought to the floor for a vote,
Right.
but more and more senators and House representatives are signing on to that bill. But it doesn't look like that's going to pass so quickly in this political environment.
I know.
But New York State is a progressive state, as is California. And in Canada, what happened many years ago, Saskatchewan, a province in Canada, passed the single-payer bill, and then the rest of the other provinces joined on. So we're hoping that's what will happen in the United States.
Okay, I just want to clarify another point, because I know people watching the show may have been taken back like I was of all this good news that you're giving us. The concept of public funding and private delivery, that means you don't that the government doesn't choose your doctors. You
Right.
still can choose your own
Any
doctors.
doctor that you choose.
Right. Okay.
Any hospital.
So as a result, that's not socialized medicine. Socialized medicine is when the government assigns you a
This
a
is like
doctor.
Medicare.
I've learned, and I'm not, sometimes people get confused. Some people, you say the word social or socialized, oh, the communists are coming. I don't know. I don't mean to make fun of anybody,
No,
but,
no.
not everybody understands
Canada's
this.
not a communist country.
Right, but they get confused because, this guy, Marxist, who started communism, was a socialist. So
Yeah.
people use terms intermingling, and
No.
they just confuse other people.
Well, we feel that health care is a human right. This is a life and death situation for many people. The cost of drugs are a life and death situation. Getting the treatment that you need. And we feel it's like the fire department. Do you say, well, it's only if you can afford it that you can have, if you have a fire, that the fire department will come to you? When it's a life or death situation, education everyone is entitled to. And we feel that health care is a human right.
Okay, I want to move you along now. How can citizens, what's the current status of the bill
Okay.
in the state legislature, and how can citizens apply pressure on their state legislators to
Yes.
pass the bill? Yeah.
Well, the League of Women Voters and is part of the Campaign for New York Health. And this is a group of over 200 supporters, many unions, many healthcare organizations. Probably the Nurses Association is the biggest supporter for this. And we've been doing grassroots advocacy. We hold forums. We write op-ed columns, letters to the editor. We speak to different groups. So it's coming from the ground up.
So
And
who would be the key legislator?
Well, so far in the State Assembly, it has passed for the past 3 years. It just passed for the third time 2 weeks ago by a vote of 94 to 46.
That's great.
And Richard Gottfried, who's the head of the Healthcare Committee in the State Assembly, has been sponsoring this bill for many years.
So it's the state senate now.
Now the Senate, the state Senate is the problem. There are 63 state senators. We have 31 co-sponsors. That's just one vote away from a majority in the state Senate.
Okay.
The problem is...
Can you tell us, because we're running out of time, can you tell us I believe there are 2 or 3 principal state senators to contact, right?
The problem is that even if it had a majority in the state Senate, it is up to the leader, and his name is Senator John Flanagan, to bring the bill to the floor for a vote. If it's not brought to the floor for a vote, it's going nowhere. So I would urge people to call Senator John Flanagan, and I think we have his contact information coming up.
Yes, we'll be flashing that on the screen.
And the other important person is Senator Kemp Hannon, and he is the chair of the Health Care Committee. And another senator who's also local that has not signed on to the bill is Senator Murphy, Patrick Murphy, and he's in Putnam and Westchester County.
Right.
So I urge people to call him. Yes.
Right. We have to put pressure on these legislators if they get the message.
Yes.
That if they get the message, these legislators, that you are watching them because they're into power. They like their positions. And if they understand that even people in their own parties are concerned about their future and we can override that, then this bill will pass.
I urge people to call. It's a simple thing to do. And these legislators have been getting thousands of calls. Another thing people could do, we have postcards, you just put your name and address in, and it says, "Dear Senator, New Yorkers need truly universal, publicly financed health care because health care is a human right. Please sponsor the New York Health Act this session. It's time for New York health care for all of us." And if you just mail the postcard to this name at the bottom of the screen, and to get postcards, you can either contact me on my email address, or you can, and then there's an address to mail it to on the bottom, and we'll forward it to the senators in your district.
Thank you very much for coming on the show. I wish we had more time. We will be inviting you back for more issues. Thank you very much.
One more thing. This Senate ends June 21st, so please do this as soon as possible. In fact, today is call-in day for New York Health Bill around New York State. So
thank you very much. My guest has been Madeline Zevon, Healthcare Chair of the League of Women Voters of New York State and Westchester County. This is Dennis Rudin saying so long for Profiles and Issues.